present. Danny Cougar.
Thank you, Mr. Deputy Speaker. I want to start by paying tribute to the work the ministers have been doing, and I recognise they are in an incredibly difficult time and doing their best, and I pay tribute to them personally. They're trying to strike a balance between, on the one hand, clarity and giving, as my honourable friends here have been saying, a consistent message to the public, but also trying to achieve flexibility in recognising that the infection works in different ways in different places, and that they need to strike a balance between the national and the local. And this is not easy, and I recognise the challenge in striking that balance. I don't want to talk about the risk to the economy that we are facing, because honourable members have made that point very powerfully. I simply want to raise the tragedy that this pandemic represents to our communities. The tragedy is that as a virus, it works through human relationships, through families and households, through communities and through the gathering places of our neighbourhoods, the pubs and churches and sports fields, the institutions that give people not only pleasure in their lives, but actually give identity and meaning to our lives. And I know that government shares the sense of tragedy and wants us out of this situation as soon as possible. So I concede and I accept the advice that the government is getting on the transmission and on the value of all the different lockdown measures. So I simply want to make an appeal for a response to the virus that is less about big business and big government. I accept that why big business and big government, why Deloitte and Public Health England were called in at the outset, but surely we can say that we have tested that approach sufficiently to suggest there might be a better way of dealing with this. A response that's less about big government and big business, that is more about local communities and trusting the people and the places and the professionals in our local places. So I hope that as we move through this terrible winter, and I know that government shares a belief in the importance of civil society, of local government, of trusting public health professionals locally, we can adopt a different model and rely less on the undoubted intelligence and goodwill and good intentions of people in this postcode, and more on the people in the places that we represent. Yeah.